Hello, my name is Nina McKay. I'm a student nurse at the University of South Alabama College of Nursing, and today I'll be doing my IV checkoff. If I could have my assistant here slowly scan the room. I like to begin the checkoff by reading the patient care order form and the hospital policy before I enter the patient's room and perform hand hygiene. I'll introduce myself to the patient and check the identifier. So I have Jaguar Jones, date of birth August 25th, 1963, date of birth August 25th, 1963, allergic to penicillin, unallergic to penicillin. I would then ask if he has any other allergies or anything. He says what he says, and then I would explain the procedure to the patient. So basically I'll be inserting your IV today. So after I had done that, I would then provide privacy, move my trash can to where I needed to be, and then perform hand hygiene before donning on my goggles. Once I had my goggles donned, I would raise the bed up to a level working height and let the side rails down, keeping the patient in supine position, or he can be sitting. So after I've done that, I would then open up my items that were gathered beforehand. Place it there. All right. I have all of my items unwrapped. Now I would then begin, drop that in the trash, using my alcohol swab to clean the injection cap thoroughly before discarding of that in the trash as well. I will then use my spoon and discard that in the sharps container and place the tube. All right, now that I have that on, I'll then begin priming the tubing. If I can get it to prime, that would be great. There we are. We have some drip. I'll then loosen up the cap there for later on when I get to using that. And then I'll make sure that that is out of the packaging as well. So after I've done that, I will now be stating three principles for selecting a vein. You want to select a juicy, bouncy vein. You also want to select a vein that is the most distal if possible, or a vein on the non-dominant arm. Also, three principles for fostering venous distension. You would like to open and close the hand continuously, or you could rub the vein to get it to pop out, or you could also use heat as a vasodilator. So after I have done that, I will then place on my tourniquet 4 to 6 inches above my injection site. Make sure that it is tight. I would make my little X and tuck it underneath, because that is the most comfortable way for me to place on my tourniquet. Make sure that it is tight, and my arm keeps moving, sorry. But after I've done that, I will then perform hand hygiene before placing on my gloves. All right, now that I have my gloves on, I will then move my saline lock over here, and then I could grab my chlorhexidine, and then I'll use this, and within 30 seconds I would go vertically cleaning around the injection site. And then horizontally. And then in a circular motion. And then I would discard it in the trash. And then I would allow for the site to dry completely before I went in with my needle. So we're allowing it to dry. Once I've done that, I would then grab my needle, dispose of its contents in the trash, not in the trash, in my sharps container, my bad. Also that piece in the sharps container. So before I begin inserting it, I will make sure that I do not touch the insertion side or the area that I cleaned it. I would place my hand here and pull down on the skin some about 1.5 to 2 inches before I begin inserting my needle with the bevel up. So as I'm pulling on the skin, I will begin inserting at a 10 to 30 degree angle. And then once I have that, I will slowly begin inserting. I will let the patient know that I am inserting. All right, Mr. Man, I will begin inserting your needle now. Not your needle, but your catheter. All right, so once I see blood return, I will inject it. I will lower the needle, and I would have made sure that it is parallel to the vein before inserting it about 1/4 of an inch back into. So next I will then pop the catheter into the vein more while keeping the needle from going inside of the vein. Keep my hand there to keep the catheter in order. I will then remove the tourniquet. So while placing some pressure about 1 1/4 inch above the insertion, I will then remove my needle and place it into my sharps container as well. Now that I have done that, I will, as soon as possible, place my needle, not my needle, but my syringe and my saline lock onto the insertions catheter. After I've done that, I will place a temporary piece of tape. Temporary tape onto the patient's skin. Since I've done that, I can now aspirate for blood. So I'll pull back on it, on this syringe, while also, well, if you would be still, making sure that I completely flush the vein. So while I'm doing that, I'm making sure that I can see that I do not see any swelling or anything. So making sure that the vein is getting completely flushed. I would expel all the contents within my syringe, but to avoid making a mess, I would not be doing that today. So after everything is expelled from the saline syringe, I would remove my syringe, and then I'll place this into the sharps container. And then after I've done that, I would grab my tegaderm and I would place it on, place it, and I'll just be discarding that later. Making sure I don't touch the sticky part. I will place my tegaderm here. All right, I can now remove the paper around. All right, now that I've done that, I can discard this in the trash and place on my permanent tape. And since this tape does not look like it has anything wrong with it, I will just place my tape underneath it, making sure it can be seen. All right, now that I have that done, I would clean up my mess, making sure that everything is out of the way. Grabbing all of my things. I will then, after I've done that, I will then place this as well. This is my one break-in sterility. I would have placed this in the shopping container as well, because I would not want any of the contents to be the blood contents or anything to be exposed to the patient or myself. So I would have placed that into the shopping container. So after I've done that, I've cleaned up my mess. I would come back to the patient's bed, and I would let the bed down. And after that, I would remove my gloves and perform hand hygiene. Before I would perform hand hygiene, and then since the patient's bed is now down and the rails are up, I would go in. I would explain to the patient how not to get his IV dislodged. So basically, you just want to not bump into anything or not get anything. You want to be careful when moving around. Make sure you don't do too much moving that would dislodge the IV. So next, I would teach the patient about the complications of IV. So you have the dislodging, you also have inflammation, and also phlebitis. So after that, I would then wash my hands again, and then I would go document name, date, time, the location of the IV, the number of times it took for me to get my IV inserted. I will also document whether or not the gauge and the length of the IV I use, the catheter I use, I'm sorry. And then after that, I would document the flow rate and if there is any infusion that was used as well, and the patient's response to the entire procedure. Now I have been given orders to discontinue the IV. So now that I have that, I would also like to note that before I left the room, I would have placed on a tape with my initials on it, the date, the time, and the gauge onto the dressing and take it out. So once I have done that, I would go in and I would tell the patient what I would be doing. I would go in and I would tell him that I'll be removing your IV today, sir. So I would begin by placing on, I'll be removing this part first. So making sure that I remove it towards the insertion site. Removing all of the content. Alright, I have that out of the way. Next, I will place a gauze over top of the insertion site. I will then remove my tape. as well. And I will carefully remove the needle. I will let him know that I'll be removing his IV. So I will remove it slow and steady and parallel to the vein and the skin. All right. I will then check the intactness of the IV. And once I have done that, I will then place it into the sharp container. After I've done that, I would observe to see if I see any redness, swelling, any pain or tenderness, or any drainage. And after I've done that, I could then discard of this as well into a biohazard container since it has blood on it. And then I will place a gauze over top and a piece of tape, which is kind of small right now, but yeah, over the. So after I've done that, I would let the bed rail back down. Oh, let the bed rail up and let the bed back down. I would go in and I would move things closer to him, such as the remote or the call button, and make sure that he is comfortable in the position that he is in. I would then remove my gloves. Making sure that I've already had all of my trash removed from the patient's room. I would then perform hand hygiene once again before I would go and document my findings.